Welcome everyone. My name is Alison Alari. I'm for the Policy and Sector Support Officer at Injury Matters. Before I begin, I would like to show my respect and acknowledge the traditional custodians of this land and of the elders past and present on which this event takes place. Just some quick housekeeping. We will be saving all the questions for the end of the webinar, but if you do have any questions, please feel free to send them through to me, which is just in the chat function on the webinar menu. So Injury Matters is a for-purpose, not-for-profit agency leading the way in preventing injuries. Sorry, 1 second, just fixing up the slides. There we go. Injury Matters is a for-purpose, not-for-profit agency leading the way in preventing injuries and supporting recovery in Western Australia. Our aspiration is that all West Australians live a life uninterrupted by injury. We do this through the provision of injury prevention programs and services. We achieve this through the delivery of our 3 core programs: Stay on Your Feet, Road Trauma Support and No Injury. So Road Trauma Support is a free statewide service providing free counselling sessions for anyone affected by road trauma, regardless of when the incident occurred or what level of involvement the person had. Stay on Your Feet is WA's falls prevention program for older adults living in the community. Stay on Your Feet aims to reduce falls and fall-related injuries among older adults living in the community and to encourage confidence in independent living. And the third program is No Injury, which aims to enhance the capacity of people and organisations to deliver evidence-informed injury prevention and community safety activities. It is through this program that we are delivering the webinar today. So No Injury is provided by Injury Matters and funded by the West Australian Department of Health. No Injury builds the capacity of health professionals, local governments, not-for-profit and community organisations to deliver injury prevention activities through providing knowledge, training, resources and networking opportunities. We do this through Know, Learn, Connect. Knowing about different injury types, learning about injury prevention practice, and connecting with other people and agencies conducting injury prevention around Western Australia. Through Know, we provide the Knowledge Hub website, resources including toolkits, fact sheets, and also a monthly e-news. Learn, we encourage people to learn how to prevent injuries in the community by providing training around a public health approach to injury prevention. And Connect, we provide Connected, the regional network group, and the e-directory. So Connected is a networking tool that randomly pairs you with another practitioner working in injury prevention bi-monthly. Your only obligation is a 15-minute conversation. It can be a great opportunity to network, share ideas, and find out what else is happening in the sector. There are people from all over Australia, New Zealand, and Canada. The Regional Network Group is a group of injury prevention workers who meet bi-monthly on a Friday morning to share knowledge and information about upcoming projects and issues. Attending meetings is a great opportunity to connect with practitioners in every region of WA. So for more information on No Injury or any of the Know, Learn, Connect projects or resources, you can visit the website at www.knowinjury.org.au. So, injury. What is injury? So it can be defined as intentional or unintentional harm to a person resulting from contact with an object, substance or another person, either through excessive energy or the sudden absence of vital elements such as oxygen. It can further be described as a mental harm, suffering, damage, impairment or dysfunction caused to a person as a direct result of some action, perceived threat or failure to act by some individual. So a brief snapshot of injury in WA in 2012. There were 227,000 injury events, which included, which includes emergency room visits, hospitalisations and deaths. The total cost of injury in Western Australia was 9.6 billion, and costs were calculated based on health sector costs, long-term care needs, loss of productivity and a loss of quality of life. So let's more specifically look now at violence injury. For the purpose of this webinar, we will be focusing on youth violence. So youth violence can be defined as an intentional act using physical force against another person or group with consequences of injury, mental harm or death committed by a person between the ages of 10 and 24. There can be varying degrees of youth violence. For example, some acts such as bullying, hitting or pushing may result in more mental than physical pain, while acts like physical or sexual violence and homicide can lead to serious injury or even death. So looking now at some data, what is the data saying about violence injuries in Australia? In 2014 to 2015, there were just over 19,000 cases of assault in Australia. Of these, 2/3 were male. Gender differences by age group were apparent, with higher numbers of cases among men occurring for every age group. For both males and females, cases of assault were more frequent from the 15 to 19-year-old age group onwards. Among males, the largest number of cases due to assault occurred in the 20 to 24 age group, while among females the largest number occurred in the 25 to 29 age group. So the relationship of the perpetrator to the victim of the assault is presented in these two tables. As you can see, gender differences are apparent, with 45% of female violence injuries identifying the perpetrator as the spouse or domestic partner, compared to just 4% for males. For males, hospitalisation as a result of assault, reported perpetrators were more likely to be a person or persons unknown to the victim, with just over 17% for the two categories combined. The type of perpetrator was also different by age group of the victim. Youth aged 15 to 24 years had the highest rates of hospitalisations from assault, when the perpetrator or perpetrators were unknown to the victim at nearly 16% combined, compared to 12.8% from a spouse or domestic partner. I think it's also worth noting here that in almost 50% of cases, an unspecified person was listed as the perpetrator, which highlights the issue with the reporting of violence injuries. Hospitalisations lacking specific information about the perpetrator may have occurred for a number of reasons, including information not being reported by or on behalf of the victim, or information not being coded correctly or recorded in the patient's hospital record. So looking now at violence injuries within high-risk populations, some populations within Western Australia have disproportionately higher rates of violent injuries than the general population. Indigenous peoples, the age standardised rates of assault are 13 times higher in Indigenous peoples when compared to non-Indigenous peoples. The socioeconomic status, although the proportion of assault cases in each socioeconomic status group range between 7 and 42%, with the highest proportion of both males and females were for people living in areas with the lowest or most disadvantaged SES classification. For females, 6 times the proportion of assault cases occurred for those living in areas with the lowest SES classification compared with those in the highest, most advantaged SES group. So regional and remote communities, the age standardised rate of injury due to assault in 2014 to 2015 varied according to remoteness of their usual residence. So the rate of assault in very remote areas was 14 times higher than the rates in major cities. So violence injuries in Western Australia, more specifically now. So looking at violence injuries in WA in 2015, residents were hospitalised a total of 3,540 times for injuries due to assault, and other injury caused by other persons, which consumed just over 11,000 bed days and an approximate cost of just over $22 million. In 2012, 943 violence injuries, including both fatalities and hospitalisations, were recorded in the 15 to 24-year age group. So I think it's also worth just having a quick discussion about some of the violence data limitations. So a lack of data on violence injuries at the local government or even population level has made it difficult to determine the true extent of the issue, and therefore can make it difficult to develop appropriate evidence-based initiatives. Cases of injury due to intentional assault may be difficult to identify and can often go unreported or untreated. Therefore, the hospitalisation cases that we do see are likely to be those that are moderate or to severe end of the injury spectrum. So feelings of shame or embarrassment may underlie reticence to admit to intentional violence injury. In addition, most injuries due to interpersonal violence can have potential legal implications. Pressures to not reveal assault may be particularly likely in circumstances where a child or other dependent person by a caregiver or spouse are involved. Cases recognised as possibly being due to assault, but I guess where doubt remains, may therefore be coded in the hospital as an undetermined intent. So just for local governments who are looking to develop a violent profile for their communities, in addition to the hospitalisation data, you can also access the WA police data, which can help to create a more thorough picture of the extent of violence injuries in their community. So this data can be accessed through WALGA or alternatively online. So now, without further ado, I will pass you over to Professor Cheryl Hemphill from the University of Melbourne. So just give me 1 second. Great. Cheryl, have you got control over that now?
Okay, so can everyone see the slides?
Yes, we can.
Okay, great. So thank you very much for inviting me to talk with you today about preventing youth violence, what does and doesn't work and why. And good morning to you all. I'm assuming you're all in the morning time zone because I'm in the afternoon time zone, but that's all right. So what I'm going to talk about today is just give you a bit of an introduction about the sort of framework that I've taken in coming to this presentation and the report that was done a while ago related to this presentation, to then talk about some of the prerequisites for effective prevention, to go over what doesn't work and explain why it doesn't work or why we think it doesn't work, and what does work and why, and then to give you some information about where you can go to find updates on effective prevention, because the information is changing all the time. So I think it's important that you know where to go to find some of that information. And then I'll just finish up with a summary of some of the implications. So just as a way of introduction, this presentation is based on a report that was commissioned by the Australian Research Alliance for Children and Youth, and also on a range of presentations I've done over the years on youth violence prevention, where I've been trying to get some of the key messages across. For the purposes of this presentation, we're focusing on the age of 10 to 14 years, and I think it was really interesting when Alison showed the data just before that. So this is before the real sort of peak in violence data. So that's exactly why we've picked this age group, because we want to get in before behaviours become entrenched. And this period is also important because there are a number of changes going on in young people's lives as well. So there's the biological changes associated with puberty, and also transitions like going from primary school to secondary school. And at those times, people can often be open to changing their behaviours. In terms of defining violence, for the purposes of this work, we drew on the World Health Organization definition, which is quite inclusive. So it's about intentional use of physical force or power, either threatened or actual, against oneself, another person, or a group or community. and this leads to the high likelihood of injury or actual injury, death, psychological harm, maldevelopment or deprivation. In this report and presentation, we're very much focused though on violence against other people or against groups, so we're not dealing so much with self-harm in this presentation. I wanted to just talk briefly about antisocial behaviour because it will come up during the course of the presentation as well. Antisocial behaviour is a more general behaviour, so it does include violent behaviour, but it also includes other non-violent acts that are rule and norm violations. So it can be stealing, shoplifting, wagging school graffiti and so on. And what we know about young people who engage in violent behaviour is that they're quite versatile in their behaviour, so they can also be engaging in these non-violent behaviours as well. So it's worth keeping in mind when we're thinking about how we can prevent and intervene early with these behaviours. Now I'm coming at this presentation very much from a public health perspective, and so I will talk a lot about risk and protective factors and the importance of data, and I'm glad that Alison raised that in her introduction as well. So to start off with, I think we need to consider the risk factors and the protective factors that have been shown to predict violent behaviour and antisocial behaviour, and to particularly take a developmental pathways approach to this. So to consider the risk and protective factors across the lifespan. So you can see on this slide for the risk factors, there's risk factors on the left that are very much to do with very early in life, and then it progresses as you go along to the right to sort of school age, and then we're talking more about the adolescent period and beyond. And one point I wanted to make about this as well is that often the young people who are engaging in violent behaviour have a number of other difficulties as well. So they may even have internalising problems too, like depression or anxiety, and that's another thing we need to keep in mind as we're thinking about ways of prevention and early intervention. And there's been a lot of research done on risk factors. In terms of protective factors, again, we're thinking about this from a developmental pathways perspective. And so on the left, we're talking about very early in development, so things going on in pregnancy and just after birth. And then we move on to sort of school age and then into the ages that we're talking about and beyond. And so one of the models that's really influenced my work in this area is the social development model, and it very much emphasises the characteristics that the young person brings to any interactions, but also the attachments that young people have to their families, their schools and their communities, the sorts of clear standards and beliefs within those environments that can then influence young people's behaviours, and the opportunities that young people have to engage in those communities in pro-social ways and the recognition that they then get for doing that. And I guess I sort of feel a little bit like the research on protective factors is not quite as extensive as risk factors, and I know that when we've completed analyses where we include both risk and protective factors to predict violent behaviour down the track, the protective factors seem to get swamped by the risk factors. So the stronger predictors in those analyses seem to be the risk factors. On the flip side of that, the prevention and early intervention programs that we're developing are very much focused on building up protective factors. So encouraging young people to engage in positive ways with their peers and their families and so on. So I think that there's still more research we could be doing on protective factors and their role in violent behaviour. This particular social ecological model looks very much like the Bronfenbrenner model that a lot of you may be familiar with. And the reason I'm showing this is because we've used this particular model to frame the presentation of what works and what doesn't work. So we'll be talking about what works with the individual themselves. We'll then be talking about what works in terms of the individual and their close personal relationships, so family, for example. Then we'll be talking about the social settings that are close to individuals, like schools, and then we'll also touch on societal level influence as well. So I just wanted to show you this so you can have that in mind, because that's the way that all of this information will be organised on the future slides. So in terms of what we need to have for effective prevention, you can see top of my list, and again Alison provided a great introduction to this, is data collection and analysis. So it's really important that we routinely monitor the trends in violent behaviour and antisocial behaviour, and that this informs our local and our national activities to try and prevent violent behaviour. At the moment I'd say that we could probably do better in this area in Australia. So there's a whole lot of data that I'm aware of that's available in the US that is easily accessible for researchers like myself to conduct analyses to better understand how violent behaviour develops. We don't quite have that sort of data here, so I think that's an area that we can do better at and work on. The other thing that's really important, of course, for effective prevention is that we can identify the evidence-based policies and programs. So these need to be programs that have been shown to reduce violent behaviour and antisocial behaviour with a particular target population. So for this presentation, that's 10 to 14-year-olds. They need to have shown effects that last across time. So it's not just a one-off, yes, it worked, that it's actually had sustained effects over time. And also that the effects have been replicated across sites. So it hasn't just occurred in one little pocket in a town somewhere in Australia or the US. It's happened in a multiple range of places and it's been shown to be effective. Another really, and so using, sorry, I'll go back to that. And another thing with the evidence-based approaches is to use the local data that we have to help local communities choose what's appropriate to target in their particular communities and to use the programs and policies that address those particular areas. The other main thing for effective prevention is to ensure that the approach is implemented as it was intended to be implemented. So when a program or a policy has been shown to work across settings for long periods of time, when we're doing that again in another setting, we need to make sure that there's treatment integrity and that it's actually conducted how it was supposed to be, so that we give ourselves the best possible chance of reducing violent behaviour in our setting. So in terms of evaluating programs, there's a few different places around that have come up with criteria, and they're all pretty similar. So we drew on the United States Department of Health and Human Services for this work, and you can see there that there's the different categories. There's effective, there's promising, there's programs and policies that need more research, and then there's the ones that we know have either not had an effect or they've had negative effects. So in terms of an approach being effective, it's really important that the design that was used to test the program was rigorous. So in research terms, and this may or may not be familiar to you, that's things like random assignment of participants to either a control group or an intervention group. Or it's a quasi-experimental design where we get as close as we can in the real world to doing a sort of randomised control. So we have a treatment group and then we have a comparison group who may be just waiting for treatment, for example. So we are able to look at the impact on the group that's receiving the program and the group that's not. We also need to get into that effective category to have evidence that there has been a reduction in violent behaviour or antisocial behaviour, or in the risk and protective factors that we know lead to violent behaviour and antisocial behaviour. And also that we're getting, the next thing that we need is sustainability effects. So they need to occur across time. So not just, okay, they've changed for a few weeks and then they've gone back to their old pattern of behaviours. It's actually continuing across a period of time. And finally, as I mentioned before when I was talking about effective prevention, we need to be able to show this across sites. So it's not just a one-off in one particular place, it's happening across different settings. So using these criteria, we're able to then move along and consider what does and doesn't work. So I'm going to begin with what doesn't work, possibly because a lot of my research is focused on a particular area within this category, so it's something that I am quite passionate about talking about. So these are the approaches that either haven't reduced violence and antisocial behaviour, or they've even been shown to have negative effects. So let's go. If we think about that first inner circle on our social ecological model, the individual, and also then the next circle out, so the relationships that are close to the individual. A lot of the approaches that are used in this category that don't work are group programs and therapies that only include high-risk young people. Now, what we need to keep in mind is that the sort of age group we're talking about at 10 to 14 years of age are really susceptible to any sort of antisocial behaviour influence. And so the negative effects that we get with these sort of group programs where all of these young people who are having problems are put together is most severe for the young people who are actually just starting out in antisocial behaviour. So they're not showing really high levels, which is really concerning because that's not what we want. We want to catch those young people as they're starting on antisocial or violent behaviour and put them in a more pro-social pathway. So you can see on this slide there's a number of approaches that fall under this category, and some of them are probably quite familiar to you. So there are things like group social skills training, some of the school-based group programs that are around as well. Now, while it would be preferable to say don't ever do this, and that is the ideal, sometimes that's not possible, and there are ways of minimising the negative effects of these particular approaches. So we need to make sure that the time that these high-risk young people spend together is minimised, that the interactions within those groups are highly structured, so there's not much unstructured time where they can start to get up to mischief. There needs to be a very strong culture within these groups that is fostering pro-social cultures within the group. So what often happens when you bring young people together who are engaging in antisocial behaviour is that they can very quickly start to create a deviant culture together and reward the sorts of behaviours that we don't really want them to be doing, so violent behaviours. And it can be as simple as, you know, just getting a little smile from someone for doing, you know, punching someone or something. But it's enough to then create further encouragement for a young person to continue in that behaviour. So really important that we're actually encouraging pro-social activities. The groups need to be highly structured, again, so that young people who might be inclined to behave in inappropriate ways are kept on task and don't have that opportunity. And to ensure that all this happens, there need to be really well-trained group leaders as well. So in the school setting, what do these look like? So in the school setting, we're talking about things like academic streaming, which I'm not actually sure how much that occurs now. I know it was around in my very early high school years. So that's where you might put all of the young people in one class who are struggling academically, and you may have other classes where there's, you know, students who are doing quite well. Grade retention, and the one that I've really focused on is school exclusion, so things like suspensions and expulsions, for example. And I could talk for ages about suspensions, but I'll contain it to one slide. So in terms of minimising the impact of school suspension and the potential negative effects that can have, and so I guess one of the main concerns with school suspension, and I'm talking about external school suspension in particular, is that if the student's not at school, and for these sorts of students who are engaging in these sorts of behaviours, school can often be the only protective environment they have, and so suddenly they're not in that environment. They may not have supervision at home, and so they can end up out on the streets or hanging around somewhere with other kids who are not in school, who probably engage in similar sorts of behaviours. So again, there's that opportunity for them to learn even more negative behaviours. So in terms of minimising the impact of school suspensions, to try and only use these approaches for the absolutely most severe behavioural transgressions sounds really obvious. It doesn't always happen though, so we need to keep reminding ourselves. Trying to take a flexible approach to how we deal with behavioural transgressions in schools, and there's a whole lot of schools around who do this already and they do really well at it. So instead of just jumping in and saying, right, you're suspended, thinking about the circumstances around the behaviour and also what's happened with peers and teachers that sort of fed into that, and then consider what might be the most appropriate way to respond. If the student is going to be suspended from school, then trying to work with parents to ensure that the student is actually supervised by an adult while they're not at school. And I've heard examples from other groups that I've spoken to where a sole parent has actually taken the day off work to make sure that they were at home with their child while they're on suspension, rather than to risk what they might get up to without that supervision. Also, where it's possible, to try and give the student schoolwork, and I guess this is where having an adult involved on the day that they're suspended or the days that they're suspended is important too, to I guess keep it that it is like a school day even though they're not at school, because some of these young people would actually be quite happy that they don't have to go to school. It's almost like a reward. So to keep it a little bit like it is, a bit more like school, to try and give them schoolwork with the expectation that they do it. The other benefit of that is that these young people are often struggling at school anyway, so helping them to try and keep up with their schoolwork is important so they don't get further behind. And the other thing is to really make an effort to integrate the young person back into school. So often their relationship with school is tenuous already, and you don't want the suspension to sort of really break down that connection. So trying to make efforts so that they don't feel like they're no longer a part of the school community. And I've probably said enough about that, so I'll just keep going now. Other ineffective approaches, which I won't talk about in a lot of detail because it's the same sort of rationale that I've been talking about already, of putting young people together or in settings where they may actually learn and acquire more antisocial and violent behaviour rather than diminishing it. So things like boot camps, probation or parole that's shock-based, and trying young offenders in an adult court. So that's enough about what doesn't work. Let's have a look at what actually does work and why they work. So because I'm coming at this from a public health perspective, I'm really interested in primary and secondary prevention. Again, I want to try and get in and prevent these behaviours before they get really entrenched. So they may be just starting, but we don't want them to become a regular pattern of behaviour. So primary prevention is universal programs that target all young people. Secondary prevention programs actually focus in and target more on high-risk youth. And just a reminder again that we're thinking very much in this presentation about the 10 to 14-year-old age group. So in terms of the sources of information that we looked at, there are some really good resources around, and the Blueprints for Violence Prevention is one of my favourites. So on that site you can actually look at the programs that they have been assessing in terms of their effectiveness, and they give those sorts of ratings in terms of whether they're effective or promising or need more research. So it's a really great place to go and get all of that summarised information. And there's other things around as well, like the Office of Juvenile Justice and Delinquency Prevention in the US, which has a model programs guide, and there's always new meta-analytic reviews and literature reviews coming up in the literature as well. So there's it's constant work in progress and it's challenging to keep up with, but there are, I guess, shortcuts to getting to that information. So in terms of what works on that very inner circle area, at the individual level, social development training has been shown to be a particularly effective approach, and most of these sorts of approaches are aiming to increase the protective factors in a young person. So it might be individual skills, like social skills, it may be attitudes or beliefs that can help to reduce the young person's tendency to engage in violent behaviour. And you can see on this slide there are some other programs that are being evaluated. So the P means promising. So they're still being looked at the moment. And like I said, you can check in with some of the websites around to see whether a program actually moves up into the effective category. In terms of relationship approaches, so these are the second circle, so where the individual has the most sort of personal contact with social environments. There's been a lot of research done on different aspects of family therapy, and there's been some that have been shown to be particularly effective, so functional family therapy and brief strategic family therapy. So these are about improving family relationships. And then parent training, which is an area I know quite a bit about because I did my PhD in that area, has had a huge amount of research, particularly with young people engaging in conduct disorder and antisocial behaviour, to try and improve that behaviour. And so there's a lot of information for parenting training on what works and extra bits you can add on to make it even better. So, you know, you might add on a component that deals with the marital relationship, or you might build on a component that helps the young person learn problem-solving skills, or there might be a teacher component as well. So there's a lot of information on parent training, and it's also been conducted with a range of different cultural groups as well. So the evidence on that one is really quite strong. Then in terms of the relationship level but involving other adults, some mentoring programs have also been shown when they give support to high-risk youth in all aspects of their lives through a one-on-one relationship with a caring adult in a professional sense, that they can actually lead to reductions in antisocial behaviour and violent behaviour. And so one of the main examples of that is Big Brothers, Big Sisters. And so you'll find that on the Blueprints for Violence Prevention website. In terms of schools, this is another area where there's been quite a lot of research done, and there's an awful lot of programs out there as well. So sometimes it's tricky to know which ones have actually been shown to work and which ones haven't. So an example of one that works in terms of teacher training in behaviour management is the Incredible Years teaching approach. Now, Incredible Years also has other components. The developer, Carolyn Webster Stratton, is familiar to me because of the work she's done on parenting. So you can have the Incredible Years teaching, but you can also have parenting and something for the young people as well. There are other areas within schools where there needs to be more research done. So for a while I've been interested in restorative practices used from a prevention perspective. So that means, you know, really going back to encouraging young people to think about their behaviours and to have these core questions that young people ask of themselves when they do something that maybe they shouldn't have, and to consider the other options that they could have used. There's a lot more research that needs to happen in that space, and likewise for some of the school-wide reforms like positive behaviour support, there still needs to be more research for us to really know that they can confidently be relied upon to reduce violent behaviour and antisocial behaviour. I think one of the interesting areas of development in this space is the increase in the use of mindfulness and meditation in schools. So for example, the Mind Up program, which is on the Kids Matters website and was developed in the US through the Horn Foundation, which is Goldie Hawn's foundation, So it's very strongly based on neuroscience, positive psychology, and social learning teaching ideas as well. So it seems like it could potentially have some positive effects, but we're still waiting for the research on that, so it's very early days on that. But that's a space to keep an eye on, I think. In terms of that sort of the third circle out from an individual, so the proximal level step out from relationships, there's some research around about communities of care, which I imagine there's a few of you in the audience who may know about that, because there's been communities of care in Bunbury and also in Margaret River. And there's also some roaming here in Victoria as well. And so that was developed in the US. I have had some involvement with that in the past, so I know a little bit about that. It's very much focused on using local data, either data that's available or survey data that's collected as part of the process, then using that data to identify programs that can be used in the community that have been shown to work, and then again collecting data and monitoring what's going on to evaluate as you're going along. The other area that's showing promise at the community level are structured programs and activities that are open to all young people. So just take a second to read that. So it's structured programs and it's open to all young people. So that gets around some of the challenges I was talking about before for what doesn't work with group approaches that put high-risk youth together. So the important elements of structured youth programs are that they are structured and they're conducted with adults, that they bring together both high-risk and low-risk young people. So you wouldn't want to have too many high-risk in one group, but you can mix it up a bit. And sometimes there's concern that there may be a contagion effect and that putting the pro-social young people with young people who are engaging in violent behaviour may actually lead the pro-social kids in the wrong direction. There's been research that's shown that doesn't actually happen, that what happens is if you've only got a couple of young people who are engaging in problematic behaviours, they actually learn the pro-social behaviours from the low-risk youth. Of course, in this sort of setting, there needs to be really active adult supervision to keep an eye on what's going on and to put an end to anything that might be heading in the wrong direction. So again, you need an experienced group leader or a therapist involved. And the opposite to what I was saying before, they do need to be really highly structured as well. So I mean the opposite in terms of what doesn't work. So if you don't have structure, it doesn't work. If you have it really highly structured, then it's more likely to be effective. Then there are multi-level approaches. Now, if we think about the development of violent behaviour, and we know that there's a whole range of factors that are important, then it's not surprising that a lot of the effective approaches actually use more than one component. So it's a bit like what I was talking about before. You might have your teacher training, but you might also have parent training, and you might also have something that helps the young person learn social skills, for example. So these approaches that target multiple areas of difficulty for young people can be particularly effective. Why aren't they used more often? Well, with any extra component, it becomes more expensive. So it's a sort of cost-benefit analysis that needs to be done in any community. And likewise, there's also approaches within the bullying prevention area that, again, target multiple areas in a young person's life and can be effective in reducing those behaviours. So we're not just focused on changing the young person, we're also interested in changing the environment around the young person, which then makes it more likely that any changes the young person achieves will be maintained over time. In terms of the societal and macro level, so this is the very outer circle, there's really a lot more research that needs to be done in this space. There are some interesting results coming out about marginalisation, so in reducing the impact of low socioeconomic status. So in the US, for example, there's been an approach where they've moved families who are living in poverty-stricken areas into more well-off neighbourhoods, and they've actually found that violent behaviour and antisocial behaviour reduces by doing that. Ross Hommel has been doing some interesting work here where he started quite early in development, but it's quite an intensive approach that targets a whole range of areas, again focused on trying to reduce the risk associated with low socioeconomic status, and again it's showing promising effects. So we need to be doing a bit more research in this area to get a better understanding of what the possibilities are here. So why do these approaches that I've been talking about just now actually work? These are probably the key principles that you might want to take away from this presentation so that when you're looking at programs that are out there, you can weigh them up against these principles. So Nation and his colleagues identified 9 key principles which they organised into 3 main areas: program characteristics, matching the programs to the target population, and implementing and evaluating prevention programs. So what are we talking about here? If we look at the program characteristics, the program needs to be comprehensive. So we're talking about it covering off hopefully a few different areas of risk or protective factors for the young person so that it's more likely to have an impact on behaviour. So the multi-component approaches, stand out there, but there are other comprehensive approaches around too. There needs to be a variety of teaching methods used, so not just didactic, but also role-playing, practicing skills and so on. There needs to be enough dosage that it can actually have an effect. So there's no point in cutting back on the length of a program if it then isn't sufficiently strong that it can actually produce the effects. There needs to be a certain amount of dosage to get the effects. It needs to be theoretically driven, so there needs to be good theory behind it. So a number of the approaches like parent training, family therapy, they have a good theoretical basis to them, so we have a bit of an idea about why they're working from that theoretical perspective. And also the program needs to promote positive relationships between the young person and peer and adults. So that's the first area. The second area of matching the programs to the target group, really quite common sense here. So we're talking about making sure that the timing of the program is appropriate for the stage of development for the young person. So as I mentioned, with 10 to 14-year-olds, that transition from primary to secondary school can be a good point for intervention. And of course, they need to be socio-culturally relevant to the target group as well. So we need to make sure that what's being used fits with the community and the cultural norms where the program is being conducted. And in some areas, we still need to do quite a bit more work on that. And finally, in terms of the implementation and evaluation, these are ones that I've touched on a little bit already. So making sure that we are monitoring and evaluating the program as we go along to ensure that it is having the sorts of effects that we would expect it would have. And also for ensuring that implementation is handled appropriately, having well-trained staff can be a really good way of ensuring that. Some programs also have highly developed manuals as well to try and ensure that implementation is done to a high standard. So in terms of the key resources, and I'm getting towards the end, I'm aware of the time, key resources where you can now go to and hopefully keep up to date on the sorts of programs that are effective. So there's the Blueprints for Violence Prevention, which I've talked about a few times now. There's the Campbell Collaboration and the Cochrane Reviews. Some of these review sites are really great because you can go in and look at the abstract even of a paper and you can immediately get a sense of, okay, so what did they find actually worked with violent behaviour or not very quickly. So they're really good resources. There are a lot of reviews around as well that pop up from time to time. In terms of Australian resources. The Australian Institute of Criminology has something called Trends and Issues in Criminal Justice and Crime, and some of those, they're written to be more user-friendly, they're not so academic, and they often have reviews about what might work with violent behaviour or antisocial behaviour, so keeping an eye on those. Also, the Australian Institute of Criminology, I'm trying to rush, sorry, offers grants for researchers to try out approaches in communities, and those, when they're completed, there's the reports from those projects on their website, so that can be an interesting place to look. There's a whole lot of mental health and wellbeing resources out there through Mind Matters, Kids Matters and so on. I know that our Department of Education here has a catalogue of evidence that you can look up. You know, there's a National Centre Against Bullying. There's a whole lot of things out there that you can use to find information. So just to summarise before I stop, to do violence prevention well, I would say we need to be doing really good research on the different levels of intervention and the ways that they've been implemented to identify the most promising interventions. I think it's really important that we still have some new ideas coming in. So if there are ideas out in the community that have good foundations, it's really important that we do look at those as well and start to get them tested out appropriately. Then once we know or have information about what we think works and doesn't work, to disseminate that evidence so that others who are out in the community thinking about what they can do can actually access that information, and hopefully presentations like this help a bit with that. And then to also ensure that we have practical procedures that monitor the implementation to make sure that it is conducted as it should be to get the sorts of effects that we really want to have and reduce violent behaviour. In terms of effective action, and this is pretty much my last slide, we need to prioritise prevention and early intervention. That doesn't necessarily mean only in the early years. It can mean at different points of development where behaviours are developing. I would argue like at the 10 to 14 age group. So we need to be thinking about ways we can intervene across the lifespan, but early in the development of the behaviours. So therefore we need a developmental pathways approach so that we know what happens across the lifespan. Ideally, we'd have multi-level approaches that do address the multiple factors that impact on violent behaviour and antisocial behaviour. We know there's a range of factors. We know those factors differ across communities. We need to identify the factors in the communities and target those appropriately. And so that really leads into the final point, which is just how important local data is and having effective monitoring in our communities so that we can identify where there might be difficulties in the community and target those and hopefully reduce violent and antisocial behaviour. Just want to acknowledge Rachel Smith, who worked with me on the ERACI report and on an earlier version of this presentation as well. ERACI for funding the work that we did on the report, which I think is probably still available. I forgot to actually check. And the University of Melbourne and Murdoch Children's Research Institute where this was conducted. So I'll hand over to questions, sorry.
If anyone has any questions, would they like to send them through? I actually have a question here from Felix Ross. So he would like to know what classifies high risk when discussing targeted programming. Only those engaging or exposed to violent behaviours or low SES, Aboriginality, low school engagement, intersectional disadvantage, etc. This is in regards to ensuring programs are open to all YP youth programs, not just high risk.
Yeah, that's a really good question, and look, it does vary. So, you know, it may be that a particular cultural group might be considered high risk, or it may be that we've got evidence that these young people are already engaging in behaviours, although it could also be the combination. So it depends how far along the spectrum of prevention we go. If we're talking about primary prevention, obviously we're talking about including potentially everyone. In terms of secondary prevention, there's different levels of secondary prevention, so it might be not all that much different from a universal approach, or it could be very specific. So I think that I can't give a definitive answer on that, but again, you need to be guided by the information you have within your communities about what groups might be most in need of assistance based on your experience and your data.
Great, thanks Cheryl. Was there any other questions? I've just had someone ask if we can get copies of the slideshows. We can send them around in a follow-up email either this afternoon or tomorrow. I guess I had a bit of a question, which was also, I guess, a bit of a reflection. I guess in a few instances you've, Cheryl, have referred to US programs. So would it be fair to say that the US leads the way in violence prevention programs for youth, or is it?
There's certainly quite a few, you know, they have centres for violence prevention in the US. I suppose some of the bias with me could be because I have a number of colleagues in the US, and we've been trying to replicate some of that work here. There's work going on in the UK as well in Europe, so I don't want to make it sort of seem like there's not, and that they are not doing some good work over there too. But I think that one of the challenges we face here is that a lot of the work we know about has been established in the US, and we need to be very careful about just using that here. We need to really keep a close eye on how appropriate it is for our context, because it may not always be appropriate, and that goes for, you know, even if we're drawing on something from the UK or Europe as well, that we need to be keeping in mind, you know, what is unique about our setting that we might need to take into account before we just, you know, go ahead and use something.
Great, thank you. I also have another question from Rhiannon Code, who asks, coming from a regional area where specific data isn't readily available, how can we monitor violence in our towns? Is this a collaborative effort with the police?
That's another good question. I'm aware of a group that was operating in Albury-Wodonga for a while, and I'm not 100% sure if they're still operating, but one of the things that they were able to do in their regional community was to form a really good advisory group of a range of the different professional groups within their community. So they had police, they had representatives from schools, they had local government, they had the community health centre, and so they got together and they shared information, and that really helped them to become clearer on what some of the issues were for their community, and for them to actually go ahead and try out a restorative practices approach within their community. So I think that one of the ways around it is to really try to get together as a community and draw on as many of the resources that you have there. You may have resources and information that you don't realise.
Great, thanks Cheryl. Sorry. Yeah.
Cheryl, it's Joanne here from Injury Matters. You mentioned about more research being required on reducing media violence. I just wondered if you could just briefly explain that one a little bit more, please.
So I think the picture maybe that we get from the media on media violence, we often tend to hear about the potential negative effects of media violence, and really when you go back and look at the literature, it's not necessarily as clear-cut as that. It's a challenging area to do research on, and I think that there are some interesting studies that are happening that are sort of trying to get around those. So in terms of the standards of evidence we look for, the research base that's being conducted in that area is still not quite there, but you know, there's some really dedicated researchers in that area who are working really hard on investigating that question.
Thank you. Great. Are there any final questions at all before we move on? I have got another one. Just come through from Cassidy Venner. I'm not quite sure how you pronounce the surname, sorry, Venner. I'm a youth worker from a small remote town, Carnarvon in WA. Do you have any strategies, ideas on how to assist the community in understanding the underlying causes behind antisocial behaviour and violent behaviour in youth? Antisocial behaviour is prominent amongst our youth in Carnarvon. However, there are very few people that understand this behaviour, and many people turn against the youth.
Mm-hmm. Wow, that. So I think it is, you know, very much about sharing the information about our understanding of antisocial behaviour and violence, and trying. I suppose one of the things that I've noticed in some of the regional communities is if you can just find one or two champions who can really start to get the message out there, and perhaps just start to shift a few people. I think, you know, one of the important things with any sort of change where there's quite significant change needed in the community is to just start to change a few people who are maybe a bit more open to the idea, and then you can gradually sort of move along and get into the other people who are less certain. So it sounds like there's a lot of work to be done just to try and convey that it's not just about the young person engaging in the behaviour, that there's other things happening around them that are contributing to the behaviour. And so it is something that, you know, the whole community needs to be concerned about and wanting to try and assist with. So that's going to be challenging, but not impossible.
Great. Thank you. All right then. What we might do is we might continue on. Thank you for your presentation, Cheryl. Yeah, it was really great to hear, I guess, for you to share your knowledge and expertise with us. I just got a few more slides to cover. Okay, just to let everyone know as well that No Injury has just released a new violence resource kit today actually. So the kit reviews the incidence and cost of violent injuries in Western Australia, as well as looking at high-risk populations. The resource kit also provides information on evidence-informed violence prevention initiatives in Western Australia. So you can access a copy of the kit through the No Injury website, or I can also send out a link in a follow-up email. So I guess as well just mentioning that this is kind of bringing us to the end of the webinar today, but before we finish, we would like to include that No Injury, we're really interested in the violence space, and we're really keen to hear from local governments that are working in the community delivering programs. I guess we're kind of keen to find out what you are doing in this space. So yeah, I guess if you are doing any work, please do reach out. This is just a couple of upcoming training from Injury Matters. We do have a youth injury series that we will be delivering in the second half of the year. So we'll be having a look at youth self-harm, youth and road injuries, as well as youth and alcohol. So all of these will be available via webinar as well for people living in the regional areas, and we will have information and registration on those opening shortly. So if you would like to get in touch, here are our contact details. Yeah, feel free to send us an email or give us a call, and we'll be happy to help you out where you can. And yeah, once again, the biggest thank you to Cheryl for your time today, and I guess for taking the time to share all your knowledge with us. It is greatly appreciated. So thank you.
Thanks, Alison. It's been a pleasure to be here.
Great, thank you.